Good afternoon, everyone. Thank you for joining us. Thank you for taking the time for today's webinar of the Global Health Hub Germany. It's a webinar on global health within the German G7 Presidency. I am Priti Patnaik, the founding editor of Geneva Health Files, a journalistic initiative that tracks power and politics in global health. The Global Health Hub Germany is a network that aims to bring together all actors interested in global health and wants to promote exchange and cooperation across sectors and stakeholder groups and to provide expertise on policy matters. This year, the Hub wants to pay extra attention to the priorities of the German G7 presidency and the involvement of the engagement groups. So today's event is actually the second webinar on G7 health priorities, and we'll be addressing one particular issue. If you're interested to learn more about the Global Health Hub Germany, or you want to join the network, please get in touch with the office of the Hub or visit the website. So before we start, there are some housekeeping rules so that all of this goes smooth. Please note that as mentioned in the registration process, this webinar will be recorded and shared subsequently on the website of the Global Health Hub Germany. We kindly ask all participants to mute their microphones and deactivate the video function in order to focus on the panelists. You can also participate in the discussion by posting your comments and questions in the chat, and we'll discuss them later in the Q&A. Do mention your name and your institution and to whom the question is directed. We'll get to that later. So the topic of today's webinar is accelerating the development and access to vaccines and therapeutics. On the 1st of January 2022, Germany took over the G7 presidency, as you know, in addition to the negotiations between the heads of state and governments of the G7 countries. The various engagement groups have also begun their work. Stakeholders from business, science, civil society, and other socio-political areas will be involved in the G7 process during the German presidency, and they will develop calls to action in the form of position papers for the G7 countries. A key focus of the G7 negotiations is going to be the lessons learned from the COVID-19 pandemic under the theme strengthening the capacity to respond to emerging pandemics. So leaders are addressing key issues related to funding and how to improve and structure processes to develop and distribute new vaccines and therapeutics to address future health threats more quickly and equitably. I'm pleased to moderate today's webinar and we'll try and provide some insight into the positions of the engagement groups. We have a great panel today. I'm very glad to welcome Mr. Peter Wiessner, who's a HIV and human rights activist. He currently works as the Advocacy and Communications Officer for Action Against AIDS Germany. It's a German NGO and network advocating for universal health coverage and the right to health for everyone. He participates in today's event as representative of the engagement group Civil 7. We also have Jessica Antonisse, who works as a policy and advocacy coordinator for the One campaign, a global movement that fights to end extreme poverty and preventable disease by 2030. She's been an active campaigner on issues from global health, vaccine equity to climate justice, among others. So this year, she serves as the head of the EU delegation to the Youth 7 and works within the Global Health and Solidarity track on policy recommendations to G7 leaders. Also joining us is Professor Kamradt-Scott. He's a professor and chair of Global Public Health at the School of Transnational Governance of the European University Institute. He specializes in global health, international relations, and international law. He's the co-founder, convener of the Global Health Security Conferences and also heads the Global Health Security Network. In today's discussion, Professor Kamradt-Scott is representing the Think Tank 7 engagement group. And unfortunately, in spite of the efforts of the organizers, we've not been able to have a representative of the engagement group Business 7 on the panel today because apparently because of reduced staffing level due to COVID-19, but we will bring in some perspectives from the private sector based on some of the arguments that they have sent across. So the structure of the discussion, we will have a few questions for our panelists, and at some point we'll go over to hear from some of the officials of the German government, and we will also take questions from the floor. So my first question will be for Jessica, and we'll be talking about the development of new vaccines and therapeutics. Jessica, how can the G7 states accelerate the development of new vaccines to face future threats in a timely manner?
Thank you. Thank you very much for the question and for organizing this timely discussion as well. First of all, I'd want to acknowledge that I think it's very important to acknowledge that we are still very much in the current health threat, that is the COVID-19 pandemic, and that we still need to take some significant steps there to minimize the impacts. We see that in G7 countries, restrictions have lifted, people are vaccinated, we are going back to some form of normal life, but across the world, in many parts, especially lower and middle income countries, this is really not the case. And there's a huge inequality in access to vaccines and therapeutics. And this has devastating consequences on people's lives and livelihoods. So when we are addressing some lessons learned from this pandemic and also how to face new threats, we will end up with a list of things that we need to do next time, but also this list will include things that we still need to do to make sure that the current pandemic ends for everyone, everywhere. That being said, also speaking as a Y7 representative, we have a couple of recommendations to the G7 state, and I will mention 3 of them now. The first one being to invest in strengthening of healthcare systems and research and development across the world, also in lower and middle income countries. And here we are thinking about increasing the manufacturing capacity of vaccines, but also investing in hospitals, in healthcare workers, and in research and development. This will increase the number of vaccines and therapeutics, but also it will help with distributing them, with actually getting them to people, and with people to be more likely to trust the products that come from their own country. So to tackle vaccine hesitancy in that sense. A second point I would like to make is that we can really learn from past errors around transparency, and we need more transparent procurement contracts. So we should aim to get ambitious commitments from pharmaceutical companies. We need to pay attention to transparency, to volume and access conditions of these contracts as well. And we need this from across the board, from all players, let's say, so manufacturers, but also international organizations and all countries that are involved here. I know that we have a lot of these rules also for fair competition, but extremely poor transparency, as we have seen, makes coordination super difficult. So again, this impacts the poorest countries most. An example would be that we saw that Botswana paid almost double than what the EU paid for some vaccines. And this is obviously not something that we want. And then lastly, a point I would like to make is that it's really essential for governments and organizations to keep in mind the One Health approach. This approach takes into account that human health depends on environmental health and animal health, and that it's all interlinked. And this becomes increasingly important with the threat of climate change as well. But in this link, there might also be a solution in the sense that we have early warning systems for climate disasters that we can build out to include health threats, and that we can also build out throughout the world. And this is especially an important point for us as the youth voice in this debate, because if we do not act in this way, in this system, these impacts will impact us the longest. So just to reiterate, we have no use for a vaccine if we don't invest in making it widely available and making sure that we take all other means into account that we need to get the vaccine actually to people. So we need to strengthen health systems, aim for more transparency, and keep the One Health approach in mind. Thank you.
Thank you so much. Lots of significant recommendations, including, I think, pushing for transparent procurement contracts, not only on member states, but also on international organizations. My next question is for Professor Kamradt-Scott. Professor, what conclusions do you think can be drawn from the COVID-19 pandemic to improve funding and the structures around the development for new vaccines and therapeutics? What have we learned?
Well, firstly, that the current system, well, firstly, thank you for the invitation to be with you today. And I should just clarify that while I'm here representing the T7 Global Health Task Force, I'm not actually one of the co-chairs. I'm just supporting the co-chairs in the development of their final, the preparation of their final report. I think probably, though, in response to your question, I mean, the key message really, and which is really fundamentally apparent, is that the existing system has failed us. And so we need to look at how we develop things like intellectual property, how we manufacture and distribute goods. That includes vaccines, therapeutics, diagnostics, and other critical medical countermeasures, so that everyone has at least a chance at equitable distribution and access. So we've been working, obviously, the process that has been initiated through the T7 Task Force has been to engage a series of experts all around the world to provide us with a whole raft of policy briefs and reports. And then we've been sort of building on those recommendations to now start to develop the final report that will go through to health ministers and development ministers and ultimately up to leaders. I think probably one of the first aspects to that is really highlighting the need for organisations like the G7 to actually fulfil their existing pledges. So we saw in 2021, for instance, that the G7 made a commitment of over 1 billion vaccine doses, and 870 million of those were going to be distributed via COVAX. And of course, even then tracking mechanisms that have been led by the World Bank and WHO and so forth have only revealed that about 30% of those targets have actually been met, according to the deadlines that G7 members set for themselves. And so this is really one of our first sort of recommendations and focuses, is actually to get G7 members to actually follow through and deliver on the existing pledges that have already been made. That's our baseline. And then we can start talking about, you know, what needs to happen next in terms of new measures to improve equity and access.
All right, thanks a lot. Would you be able to add specifically on funding? Would you have any specific suggestions? What's the thinking right now?
Yeah, well, look, we've received quite a number of proposals around what sort of mechanisms and measures, and we've particularly around financing that are being considered. And we've also been working with the T20 group on global health as well to make sure that as much as possible recommendations align. What we are seeing though, and we've already seen this sort of discussed in international media circles, that there is a distinction or a difference that's emerging between the United States and European partners in particular about key issues around things like WHO financing, but in particular one of the new proposals is around this development for a new pandemic financing agency. And there's propositions, for instance, around the inclusion of this in the World Bank. And I think for us in the T7 group, the key issue here is that whatever new measures we see G7 members really work towards, we can't see further fragmentation. We've already got a global health architecture which is quite fragmented. We've got multiple organisations and agencies, some of whom have competing mandates. They're also competing in the same space for funding and so forth. And we really need to try and consolidate and improve arrangements rather than sort of further diversify. So we're working through some of those recommendations, particularly on financing. I think, again, it would be premature of me to sort of articulate a position that the co-chairs have formed on this particular issue, but it is something which we're very closely monitoring and trying to work through and to work out what is the best way forward for the international community. Because we're really quite important, you know, we all recognise that multilateralism is the solution to our future and for managing future adverse health events. There's no getting away from that. And what we've sort of seen, obviously, over the last number of years has been sort of further fragmentation and breaking apart of multilateral arrangements. And we need to sort of work to try and rebuild some of the bridges that have been broken down.
Thanks so much for shedding light on these changing contours on these financing discussions. My next question is for Mr. Wiessner. What do you think needs to be done to ensure that vaccines and therapeutics are developed in a timely manner for future health emergencies? I have an additional question. What, according to you, are the pros and cons of initiatives such as CEPI?
Yeah, thanks so much for inviting me here. It's nice to be here. I think before I respond, we have to define what timely manner is. So we wait for tuberculosis vaccination now for 100 years and nothing happened. We've seen the 2018 high-level meeting on tuberculosis with commitments to finance R&D for tuberculosis, and we see that those commitments are not met. Nevertheless, there are 5 components for tuberculosis in the pipeline that might bring us a vaccine. When we look at mRNA, the new technology, we experienced that within 30 days from sequencing the virus, we will have a candidate that can go into a vaccination, into a trial, then after 100 days. And this is the aim of CEPI. It should be available. So we talk about completely different time frames. So what means time here? And I refer to my colleagues that talked before. Time means people alive and people dying on COVID-19 and other vaccines. Tuberculosis, the main killer globally beside COVID-19 at the moment, with 1.5 million people dying each year. So that's what we are talking about here. What needs to be done? I think we need technology transfer. That's the most important thing. The world, the system has to change. We need a transfer of technology. It is quite nice to see that WHO took that on finally, and it should have happened 20 years ago, I would say, or 30 years ago, but okay, it takes place now. It's a little bit late, but nevertheless, we have these initiatives that promise to share technologies. We have the pharmaceutical industry that defends their intellectual property rights and that do everything against to share the technology. We have a government here in Germany that is a little bit vague on what they are saying. So they are, our former Chancellor Merkel says that a vaccine is a public good, but on the other hand, we see a government that does everything and works against the waiver that is discussed in and that was brought to the WTO. So that there's a problem here, and this needs a discussion. This needs to be solved. The know-how, the transfer of know-how, this can only be done through education. We see initiatives like the Global Manufacturer Training Hub that just took place 2 weeks ago in Korea. We see this initiatives from South Africa. So this is something really good, a positive development. We need more transparency. We need to force the industry to be transparent. We need to force our universities that do the first studies to be transparent and to publish it in a transparent level. So we need some platforms that should be available to everyone. We've seen when China sequenced its virus within a couple of days. This was basically within a second. This can be distributed all over the place, and then the technology hubs, they can start working on a vaccine and to start working to solve the problem. So this is a vision that I have, and I think this is a vision that we should all have. But but we all know that it's not so easy. We all know that life-saving medicines, that's not only about human rights and the life of people, it's about big money. And we know of BioNTech made 10 billion of money within 1 year, and investment into science, into Forschung in science was about 1.2 million out of that. So there's a disbalance that you see all over the place, and this needs to be solved. And I think when our politicians say a vaccine is a global public good, we need to sort of force them to walk the talk and to make it happen. And this is the role for me as, or for us, probably all as civil society members. When you talk about, when you ask me about the CEPI, I think
Yeah,
CEPI is a good initiative, of course. It was created in the course of Ebola. We know that. It has a very strong vision. I like the vision with this 100-day vision. I think it's good that CEPI is financed. It is good that our government gets a lot of money, gives a lot of money to sort of finance CEPI and other governments as well, of course. This has some power. I think this is simply good. But then on the other hand, I see 2018, there was a revision of the access policies. So it's not only that we create vaccines and develop vaccines, they have to be available as well. And as I'm not an expert in CEPI, but I understood in 2018, there were decisions made to sort of be less transparent on who the vaccine should get under which circumstances. So it's a little bit in transparent. This should be changed. So these are my recommendations. Thanks.
Thank you so much. Maybe we ask you to turn on your camera the next time you make the intervention. You could check your camera. Thanks a lot. I think you brought out lots of interesting questions. Also linking back to the wait for the TB vaccine, for example. In the next segment, we will talk about the TRIPS waiver, and it kind of leads us to the next part of this discussion on the access to vaccines. Like we said, the Business 7 group has not been able to participate in today's webinar, but we do have some of the arguments that were shared by the German Pharmaceutical Industry Association, and I will just present some excerpts of what they have said on their position on the access to vaccines. So basically, the BPI, as they're called, they are of the view that vaccine production is a complex process, that only a few companies have necessary technology, and you need carefully trained and qualified staff, and a forced licensing to other manufacturers, they say, would take at least 12 months for a safe and effective vaccine. They also say that companies should be prepared to invest money in the expensive and risky development of highly complex vaccines, and they will not do so if states end up compulsorily licensing everything, and if governments decide to hand over hard-earned research to foreign hands, and this, they claim, would weaken Europe's competitiveness in cutting-edge research. And they also say that it's not patents or intellectual property rights, but the lack of raw materials and supply bottlenecks for technologies that are currently standing in the way for the expansion of production. So what they suggest is, in order to address the lack of access, they suggest that you should work in partnership with relevant companies to extend manufacturing capacities for vaccines worldwide. So this was the position that they shared. And my question to you, Jessica, actually is, we do know that we managed to, the industry and governments invested a lot of money, and vaccines were developed in a short period of time, and this could further be accelerated with CEPI's 100-day mission. But how can we ensure that all countries get access to vaccines equitably? What should the G7 commit to?
Yes, thank you very much. I think, again, this is a really important question that has also been touched upon during this conversation, because equal access to vaccines is really key to ending the pandemic. What we see now in G7 countries that we have come a long way, but for example, in African countries, an average of 15% of the population has been fully vaccinated. And I think what other panelists have also explained today is that it's part of a bigger problem, where political choices of higher income countries consistently push low income countries to the back of the line, and we stick to a type of donor recipient relationship, and we think that we really need to tackle this broader narrative if we want to make progress on access to medicine and also strengthening health systems. This is quite a depressing pattern that we've been talking about, that we are discussing, that we have also seen with other deadly diseases like malaria, like tuberculosis, and the pattern is that when the threat subsides in higher income countries, we move on, we forget about it, and the disease continues to kill people in other countries, and this is not needed. This is a political choice, a policy choice, a budget choice that we are making. So thinking about what we can do to ensure equitable access, there is a short-term immediate response that we still need, and there are long-term changes that we can make. On the immediate response, countries need to share their excess vaccine doses with countries that need them now, that have this low vaccination rate. This can be done through the COVAX initiative, and what is key here again is for countries that want to share the vaccines to start collaborating more with the World Health Organization and with countries that can receive these doses on the delivery schedules. So to make your plans public, to give countries the chance to accommodate for shipments, to actually get them to people, so that we avoid these situations where doses are donated that expire or countries cannot distribute them, and this ties back into the transparency that is needed, that was mentioned earlier. And another part of this is to think beyond the actual vaccines, but also to think about diagnostics and therapeutics. It's super important that these are also taken into account and also shared. So lastly, on the short-term response, we need funding for some of the initiatives that were also mentioned that are set up. So for example, the ACT-A, the Access to COVID Tools Accelerator and COVAX. These are great initiatives, but we did not fund them quickly or fully. So it's been a slow process. For example, the ACT-A needs about $22 billion in the next 6 months. COVAX needs $5.2 billion. The G7 host, Germany, of course, has pledged $1.2 billion. So that's a great step. But we need the US, the EU, and other big players also to pitch in here. And there's actually a replenishment moment for this on the 8th of April. So I hope that we can get some progress and get back on the right track. And then on the long term, we should look at other aspects that are also mentioned earlier. So investment in healthcare systems, and to make these investments even more valuable, we need sharing of technology and know-how and intellectual property. And there has been a conversation on this new proposal, so that's a start. But we need the scope to include therapeutics, other forms of intellectual property. And another key point is that we don't add any new requirements to these TRIPS flexibilities, which is something the current proposal is doing. And we cannot now start to take steps backward when we are finally making some progress on this point. Some lessons learned that we discussed here, and that hopefully will help us deal with the current pandemic also. And one general lesson that I take away from this entire situation, ordeal that we are now in, is that our health and well-being is really dependent on people around us, but also people on the other side of the world. So if we truly want to tackle pandemics and preventable diseases, we need a more holistic and international approach that leaves no one behind. Thank you.
Thank you so much for that. We will get to the TRIPS waiver in a minute. But before I get to Mr. Wiessner, I also wanted to ask Professor Kamradt-Scott. We often hear that one of the challenges for the lack of equitable access has been absorption capacities. It has been one of the reasons in terms of the sheer logistical challenges and so on. What do you think? How can some of these logistical routes, be sort of improved upon? How can local health systems be prepared, strengthened for the future in order to administer vaccines? What do you think should be the concrete decisions that the G7 could take to address this aspect of the implementation challenge?
Yeah, well, I mean, obviously there's a large focus on what's being described as last mile delivery, which is ensuring that when it comes to the production of vaccines and the distribution of them, that we're then able to actually get them into locations and into people's arms in a timely manner. And that's certainly one of the big challenges, which ties directly back to countries' health systems and whether or not they're have got sufficient arrangements in place, for instance, around community health workers that are trained and adequately distributed so that they can actually make sure that the vaccines get to the people that need them most. I'm sorry, I'm going to sort of diverge though from your question, because I was listening to that business statement and I think everyone's being very polite here. But let me just sort of say that I'm speaking in my personal capacity now. I find the argument that you've just read out to be disingenuous and somewhat reminiscent of what we heard back in the 1980s about from pharmaceutical companies about how we shouldn't bother trying to make antiretroviral therapies available to people living in Africa because well, they don't wear watches and these medications need to be taken in a timely manner. I mean, the arguments that are put forward here for someone that's worked in pandemic preparedness for more than a couple of decades, I just find really distasteful. I mean, we can sort of try and they raise these issues around raw materials, and it was just like, and that this is a reason why we're not going to support things like a TRIPS waiver. Well, I'm sorry, but if raw material, support a TRIPS waiver, number one, okay, that's the first step. Number two, if raw materials are the logistical challenge, deal with it. We are a global community. We have this means and abilities to actually address these challenges, rather than use it as a foil and an excuse to say, oh, well, we may as well not even bother going down this road. And, we've seen and heard a variety of different advocates pointing out that actually there is more capacity in low and middle income countries than what is often acknowledged by our large manufacturers. And added to that, I mean, the large manufacturers have benefited principally because it was all public funding. I mean, other people have made this point, and I just find it really disingenuous. We're hearing the same arguments being put forward again and again. And so I really needed to make those points because I just find it infuriating and so misrepresenting of the issues that we really need to try and focus on and deal with.
Thank you so much. Your comments are welcome. That actually leads us to my next question to Mr. Wiessner. So, do you think that the waiver actually will be a sustainable way to ensuring access to vaccines? Is that a good approach for future pandemic threats? And what do you think should be sort of other approaches, for instance, for increasing local manufacturing capacities? What could be some of the best practice examples of ways to boost local manufacturing capacities in the developing world? Just for context, the TRIPS waiver discussions have progressed, and we know that there is some form of a text that was discussed between the EU, the US, India, and South Africa, and this is now being considered. This will now be considered at the WTO, and as Jessica mentioned, it appears that there could be provisions in the current text that can actually make it more difficult to use flexibilities. Mr. Wiessner.
Yeah, thank you. First of all, I just wanted to echo what Professor Scott just said. Sometimes when I wake up in the morning, I really think that I'm back in the old days of the HIV movement, where we did fight for ARVs, where we saw millions dying, and where we experienced like 5 to 6 years until something happened. And this again seems to repeat, history seems to repeat itself. So thanks for mentioning that. The new text of this agreement you talked about, Priti, I haven't seen it. The process is not transparent. This is the biggest problem of all. So this is done behind curtains. Something leaked out. We don't know if that what leaked out, if this reacts to reality or not. As far as I understood, is that in the current text, only vaccines are mentioned, but not diagnostics and not treatments. And from a patient perspective, and we talk here about human life, vaccine alone will not change anything. We have to make the vaccines available, accessible. In order to make vaccines accessible, you need to start with testing. In order to safeguard healthcare workers, you need to test them on a regular basis, and then you can provide a vaccine if necessary. So if this is not in the proposal, I think the whole thing doesn't really make sense to me, and it is, to say the least, absurd. It's not okay, but as I said, I don't know the text. We only have rumors, and we are not part of the discussion. So civil society is not included, and this is another problem we would have to talk about. If you ask me about the TRIPS waiver, I think in order to solve these problems, there is no other way around than make treatment, vaccines and diagnostics and everything that needs to be, that needs to serve people, to make it available. This is a human right. We talk about health as a human right. We don't talk about profit as a human right. We talk about health as a human right. This is not super complicated. I think this is quite easy. And as long as this problem is not solved, as long as our government and the governments of the West, I mean Europe and some other states, and in particular Germany, as long as we value the profits of our industry as more valuable than human life, we have a problem here, and the situation will not change. So this needs to be changed. And then in terms of local production, yeah, we know that Africa, for the time being, has only the capacity to develop 5% of all vaccines needed. So they are completely dependent on us, and we use this dependency in a very structural way to get more money out of this. Let's be clear here. This is exactly what's going on, and this has to be changed. So African country and the global south, they need the capacity to develop vaccines themselves. I talked already about the initiatives that are there. I would just refer now to the WHO mRNA vaccine technology transfer hub that was established half a year ago. We see first results, we see first trainings where countries like Vietnam and other countries that would have in principle the capacity to develop mRNA technology to get the necessary training that they need. I think these are positive steps forward, and they have to be followed. So far, so good.
Thank you so much. You're not mincing words there. It'll be good to hear from our audience as well. We just sort of get some perspective from representatives from the German government who are here, and I believe we have Mr. Andreas Bergfelder from the German Federal Foreign Office, who's the coordinator for global health. And we also have Miss Katri Burton from the German Federal Ministry of Health, the Global Health Policy Unit, and Mr. Jens Busma from the German Ministry for Economic Cooperation and Development. And he's part of the Global Health Policy and Financing Unit. So I guess it'll be good for some of you to respond to your perspective on what has been discussed today. What do you think are the key takeaways, and how would you translate the engagement group's priorities into the G7 negotiations? It will be good to also get your perspective on this.
Shall I start? This is Martin here. Hi. Okay. I mean, we have several German government people here, so I'll try to focus maybe on one or two things. I would like to focus maybe on the current crisis, the current pandemic and vaccines, because this has, eaten up most of my lifetime in the last 2 years. What I want to say is, I think the public perception or the discourse here, I mean, many things are correct, and I can fully echo them, but the public discourse seems to be a bit behind, the reality on the ground. Since a few months, at least since a few months, there is no vaccine shortage anymore around the world, and there is no vaccine shortage in Africa and in not even the poorest countries. There is enough vaccines available, but we simply are not able to roll these vaccines out. COVAX cannot take any more vaccines. The countries are refusing to take the vaccines. It has nothing to do with short expiry dates anymore. It's throughout the board, through all vaccines. And it has to do a bit with logistical issues related to, cold chain, storage, what have you. It has to do with weak health systems, but it also has to do with political priorities by countries, put it simple. So the idea that we are, as the rich countries, sitting on a huge pile of vaccines that we are hoarding and not sharing with the rest of the world is, at least since, I'd say, half a year, not true anymore. I can say that because I'm desperately trying to work on that, and since months we are really in trouble, and this is for many. This goes for many big donors. Even though you might see a low vaccination rate in many countries, particularly in Africa, it doesn't have to do with I cannot get hold of enough vaccines. That's simply not the case. And this is why you have mentioned the German pledge for this year for Act A and COVAX. This is why I'd say 2/3 of the pledge will go into the so-called last mile activities across the board, from multilateral initiatives to bilateral projects. This is a very nitty-gritty exercise, so every country is different. The needs are different in every country. It's a lot of small measures, but this is what we are currently working on. I think this is the most important contribution that we can make from the German presidency in this field to actually, you have all these words of getting shots in arms, turning vaccines into vaccinations, but this seems to be, for me, currently really the biggest issue. Obviously, I also have heard this story about Botswana paying 3 times the price of Europe or 10 times the price of Europe. I think it's a bit more complicated than that, because through COVAX, certainly that is not the case. There was an initiative, I think, by the African Union to then later go into the market and try to buy vaccines themselves, and obviously they got a bad price. And this is why we have set up something like COVAX to pool demand to actually get good prices. There's also quite a developed vaccine industry in India, but I don't really want to go into the TRIPS waiver issue. I leave that for my colleagues, and I'm sure Jens Bussmann can talk a lot about efforts of the German government in increasing local production. There's a lot going on, but I would also be a bit skeptical about saying people will trust a vaccine that is produced in their country and not trust the other vaccine. Not 100% sure whether that's always the case. But I'm not saying that I personally, speaking in my personal capacity, that I'm happy with everything that the pharma industry has done in this crisis. This would be obviously a bit going a bit too far. But I think we can be lucky that we can be really lucky that we were so quick in developing vaccines and making them available. Sometimes I have frustrations with pharma industry, yes, but currently, definitely, we don't have an issue of undersupply of vaccines. And last thing on this little nitty-gritty word, the 870 million doses that the colleague has mentioned as a G7 pledge, this is a G7 pledge until end of this year, and we would easily be able to exceed this. We are struggling, all of us, to fulfill our pledges because we simply don't find anybody who is still interested in taking more vaccines. That's the reality for the moment. Thank you.
Thank you so much. Just, I would like to follow up with one question. You kind of alluded to political priorities. I guess you were suggesting that political priorities in low and middle income countries in terms of health system strengthening and so on. There is an absorption challenge, but some would argue that it's also because that some countries did order more vaccines than needed, and they did not have a plan to donate these vaccines. And now you are you're in the process of sort of donating surplus doses, but there are challenges because some of these doses are not being able to be used. Is that something that will be sort of addressed and fixed in the discussions within the G7?
I mean, with political priorities, what I mean with that is there is a WHO goal of vaccinating everybody, 70% of all people in all countries by mid of this year. Now we have a lot of countries that for themselves have set a lower goal or a later goal, and they have set this priority by themselves. It's not the evil G7 that has pushed these targets on them, but they decided for themselves, sorry, we have other problems. We have people dying from what have you, diseases in the street. We are not seeing people dying in masses in the streets from COVID. So we simply, that's not our top priority to vaccinate everybody against COVID for the first thing, as a first thing. And then for many other people also, I mean, if you need to make your ends meet every day and you live on $1 a day and you need to spend the whole day and traveling through, stand in the line to get your free shot of a vaccine, even that can be an economic calculation. I'm not justifying anything. I'm just saying that, and it is different from country to country. You cannot say, countries with the same economic profile or even neighboring countries in a region follow the same policy. So you can have a country with a very high rate political commitment from the top of the government to make this work, and you have the country next door which saying, sorry, that's not our issue. And I'm not saying that vaccine hesitancy is a purely issue of the global south. I mean, we also have this issue in Germany. I'm just stating the reality. We are also struggling to get much further than 70%. And by the way, in many countries, you have a different age setup, and you have many people that are very young. And if you want to get to 70%, you need probably different vaccines or masses of these vaccines and other regulatory issues. We have seen a lot of regulatory problems in this process of vaccine donations. It's a very complicated process. Everybody, I think, is donating mostly through COVAX. COVAX is the place that is, supposed to have the transparency, supposed to know the needs of the countries, supposed to know the absorption capacity. They are doing the allocations. They are providing full transparency to the recipient countries. So there is no secrecy really there involved. What I can say is that in reality, we as Europeans, I mean, that's for BMG, for Ministry of Health to go more into the details. I'm trying to be careful here, but it's not that we as Europeans have had great visibility from pharmaceutical countries upon our own deliveries. And you cannot expect us to have a better visibility on donations than on our own supply. I mean, throughout this crisis, I will not name any companies, but it hasn't been a steady and reliable flow of vaccines to the European countries. We are really, I think we have improved in this process. We have tried to give as much predictability as we can, but it's a very, it's for each and every vaccine, for each and every pharmaceutical company, it's different. Legal requirements, technical requirements, shelf life, what have you. And we have seen, maybe as the last thing, when there is a German donation through COVAX going through the system, COVAX is saying, look, you have provided a donation, this will go to country X. We immediately sent the German ambassador to the government of this country and say, look, there's an offer from Germany. Would you be so kind to speed up the process of giving an answer whether you want this vaccine or you don't want this vaccine? Why are we doing this? Because we have seen a lot of cases where we were losing weeks and months, where this was stuck in the system in the country. 2-3 months later, and said, sorry, we don't want the vaccines. And then we have already eaten up half of the shelf life. And then they're trying to reallocate this to others. So it's a bit of a vicious circle. Right. I'm not blaming anybody, not at all. I just simply want to say that on the ground, sometimes it's more complicated than that. Thank you.
Thank you so much. Thank you. Thank you for that clarification. I guess we'll move on to the other representatives we have with us today. Is Ms. Katri Bertram here?
Yes, I am. Hi to everyone. Hi, Priti, and thanks so much for having me. And also thanks to the Global Health Hub Germany for hosting this session. I think I'd like to start by saying thank you for all of your inputs and also for the discussion and questions in the chat. It's part of the G7 process is also to engage with the engagement groups. And I think this discussion today has again showed how valuable it is for us on the government side to have this discussion, as Martin has just had, on some of the complexities of the issues. I think I'd like to start by making one point up front, which is the current situation for global health and global health financing, and also very much impacting the pandemic and pandemic financing. I think we're here part of a cohort of believers that this issue is really important. I do think that we're also at a situation where many of us see the windows of opportunity closing for collective action and also for some of the systemic changes that many of you have mentioned in your inputs before. And I think it's really important also to remember that we are working in partnership together, government and also many of our non-state partners, trying to make sure that we're protecting the space for global health and pandemic financing, but also many of the other issues that you've mentioned in your inputs, ranging from tuberculosis to NCDs and other issues. So I think that's really important to remember up front that we are in a situation where the issues and also some of the funding risk falling off. So it's important to continue that advocacy from your side, and we're trying to do our best from the government side. I'll try to focus my comments on what many of you have spoken about in your inputs, and also kind of hone in into the G7 Presidency program that we have set as the German government. And just a reminder that it is useful to go back to that presidency program every now and then to remember how ambitious some of the targets are that we have set. So related to the discussion we're having today, accelerating the global vaccination campaign is central. It's one of the key 5 priorities that we set for us as the presidency. And that also includes explicitly expanding local production capacity. So I think that's important to remember, and also for you as non-state actors to very much hold us accountable for. Some of the points that you've mentioned as well in your inputs are really key. Martin has, I think, mentioned very well the complexities of implementing some of the programs that we're trying to do, including vaccine donations. I think Jessica mentioned the point on tackling misinformation, which is not only a huge problem in low and middle income countries, but also in high income countries. So here, we really do need to also focus, I think, work in partnership together and tackle some of these issues. I think, Peter, you mentioned the point on ensuring that we also focus on health workers and training for the purposes, also in low and middle income countries. That's definitely something that we together with our development colleagues are very much focused on as well in our health and development tracks. And Adam, I think you really well illustrated the problems we have kind of bringing together some of the new financing needs. I think we all agree that we do need more financing, both for pandemic preparedness and global health, but also at the same time ensuring that we do not fragment a very fragmented global health system and architecture, especially at the multilateral level. So really, really key points that we're working on, not only in the G7 presidency, but of course also with our Indonesian partners for the G20 presidency. I think some of the multilateral initiatives that you mentioned are really important for our work. ACT-A goes without saying, and COVAX, and I think Martin has been very clear that our support has been quite strong financially already. We're really hoping that other key partners, also beyond the G7, continue to ramp up their financial contributions and pay in their fair share. But also initiatives such as CEPI are really key for the issue of vaccine research and development and production. I saw that there was a question as well linked to the TRIPS waiver issue and whether we would have had any vaccines produced without patents. And I think CEPI is really a great case in point that there have actually been an amazing amount of trials. I think there are over 100 vaccine candidates that have gone through CEPI. So I think there are great initiatives that we will continue to support from the G7 side and also from the German government. And then one organization that, especially for the health ministry side, is of course very important is the WHO. So you'll see in the G7 presidency program as well, and this is part of the new German government coalition treaty as well, that strengthening WHO through sustainable financing is really going to be critical for our work. But there are also elements of WHO's work related to vaccine production, research, and then also the emergency response side that we're really keen to highlight through our presidency. So for example, I think, Peter, you mentioned that CEPI was founded after the Ebola crisis. The same was the case for the contingency fund for emergencies at WHO, which was set up exactly for this reason, to be able to respond very quickly in a case of an outbreak. And it's done a great job in so many different cases, but also, for example, on the current humanitarian crises in Ukraine. So it's a very underused, underfunded tool that we would like to see strengthened also in the G7 format. And then just to close, maybe I think for the engagement groups, my call would be to really reach out to us directly and share more of your suggestions. Also, proactively, we don't monitor social media as well as we should. So please do reach out as well to some of the colleagues who are here today and speak. We've got a tight time frame that we're operating in our presidency. So for example, the health ministers meeting will take place on the 19th and 20th of May. That means that a lot of the processes are already kind of running towards final negotiation stages. So it's really important to input now. So really appreciate the input you've given today and also to colleagues so far. And hopefully then we'll see a lot of those issues picked up and discussed further in the process. Thank you so much.
Thanks so much for laying out these priorities and the milestones. We will just quickly go over to Mr. Jens Wiessner.
Yeah, first of all, dear panelists, participants, thank you very much for the invitation and the opportunity to speak here on behalf of BMZ's health department. I would like to briefly touch on various aspects regarding vaccine production. It is clear, I think it's consensus that expanding local capacity for vaccine production is an essential tool for global pandemic response and prevention. As we've heard, only a few % of vaccine use in Africa are actually produced locally. We have, as a government, especially as Ministry of Cooperation, have put in place a broad support package for Africa in a very short time, since spring 2022. This package now comprises around €500 million from budget funds, KfW, the DEG funds, and our contributions are embedded in the Team Europe initiative on vaccine manufacturing. Specifically, we are involved in 4 countries, Rwanda, Senegal, South Africa, and Ghana, and also at EU level with, for example, African CDC, the African Medicines Agency, among others. And what do? We do not build production facilities, obviously, with cooperation funds. For that, we need private investment. Rather, we are improving environmental conditions. Topics include education, training of specialists, strengthening regulatory authorities, laboratory equipment, IT, cold chain management. So in each country, we try to do what is actually in demand. And this range of topics shows that vaccine production is indeed complex. We need to show staying power here. It's not the first attempt to support the development of pharmaceutical industry in low-income countries. We do need, or we do see the need to secure local production and thus also the local supply of vital medical goods. I think this is an insight that we ourselves have gained in view of interrupted supply chains, change, and the relativization of globalization. But the economic risk is certainly high. As you know, the global pharmaceutical market is highly competitive. We have large players, including from countries like India. They have well-established large-scale production that allows favorable prices. Nevertheless, a diverse private sector initiative is indeed very welcome and needed. And as we can see at the moment, initiatives are mushrooming, especially in Africa. Amongst others, the mRNA hub of the WHO, which we support politically and financially, together with other donors, has so far designated 13 so-called spokes worldwide. We see other initiatives in Kenya, Tanzania, Botswana, just to name a few. And we have to admit or to see that not all nominated countries already have the expertise and companies that can actually absorb specific know-how. At the same time, it is clear that no one can or should be denied access to knowledge in this very important initiative. We very much welcome voluntary cooperation for the benefit of all. But we also need to manage expectations. Seth Berkley of Gavi, CEO of Gavi, was probably right to point out that not all initiatives will necessarily survive. At the same time, we need to think about business models in a sustainable way. Market shaping is an important issue here. It has not yet been clarified whether and how important customers which like Gavi are usually public institutions buying vaccines and buying vaccines especially can also buy more expensive products. So the question is, should there be subsidies for this? It is also certainly at least partly public task if we maintain production capacities that are only utilized in their entirety in times of crisis. So the ramp up of COVID-19 vaccine production from 0 to probably more than 40 million doses per year is historic. But what if next year, or the year after, these capacities are no longer needed? On another note, is local vaccine production the only way to end vaccine inequity? Personally, I'm speaking here in a personal capacity. I think we will again face shortages in future pandemics, such as when new vaccines need to be developed. Hopefully, with a pandemic treaty, we will come up with binding rules on how vital commodities, such as vaccines, will then be distributed. I think, as already mentioned, transparency is a very important issue here. Oh, so these are questions we need to ask ourselves right now, even if they concern the future, middle term and long term.
Thank you so much.
Thank you.
Thanks a lot. I just had a follow-up question. I guess some of the panelists also brought this up. In what shape and form do you think the TRIPS waiver could potentially be discussed in these G7 negotiations?
This is definitely a very important question. I'm afraid, within the federal government, we have other ministry in charge of these issues. It's not one of the ministries present today. It's the Ministry of Justice and of Economics, and I'm not an expert on this. All I can say is in a personal capacity that from a development perspective, we do hope that a consensus that has been reached now can be put into practice in a way that production is ramping up and we find a way to vaccine equity. So, but if that does not work out, we have to look for other solutions. And first, you have said this 4 different countries were involved in this compromise. So I think it's worth to see if this works out.
All right, thanks. Thanks so much. And depending on who you speak to, I guess it's not clear whether a compromise has been reached. In any case, I was before we take audience questions, I was wondering if any of the panelists want to comment on some of the statements made by the representatives of the German government. Yeah, please go ahead, Professor Scott.
Look, I appreciate all of the comments that were made, and I've been working with governments for a number of years, so I accept that there's always far more complexity that is often portrayed. I think probably those of us that work in this space accept that. And challenges like last mile delivery, they are significant and they're fundamental. Noting that, there still means that we've got to do something about it. And while we can, and not all of this responsibility falls on the shoulders of the G7. I think that's also important to note. And I think governments all around the world do need to step up and make sure that they are doing everything that they can to make sure that vaccines are made available. But even, I guess, just in terms of some of the comments that were made by Martin with regards to vaccine shortages and how supply is no longer an issue. I mean, you can't really say on the one hand that vaccine supply is no longer a problem, and then in the next breath sort of highlight that in some countries, because of a younger population, the right vaccines may not be available, because that is a supply issue. So I think, and when it comes to the sort of the G7 commitments, I think, you know, the 1 billion doses, there was a commitment there that was made by the G7 to deliver half of those doses by the end of 2021, which wasn't met. And so I guess what we're sort of suggesting, and there's a number of recommendations that the task force will be putting forward, and a lot of them are very sort of evidence-based and solid. But you know, there's a lot more that can be done. It's a matter of everyone coming together, and we all see the importance of multilateral approaches to dealing with this, and the G7 is critical to that. So it's more a matter of like, let's give, you know, more power to the people that can help solve the solutions, I guess. Thanks.
Thanks a lot for that. Anyone else wants to step in to respond to any of the other comments?
Yeah,
Jessica Mr.
can I step in?
Yeah, please.
Yeah, this is more or less a comment to Mr. Bergfelder as well. I do understand that the problem might not be as fierce as it was half a year ago. But for me, the main question is, you know, why do we have this deregulation? Because that's a regulation issue. So if vaccine would be available to everyone, to every country, at any place at Earth, we would not have that problem. So saying that, I think it's too easy to say, you know, to deny that we have a current problem just because of what I mentioned before. And then in terms on the denialism that we see, and those who would deny that COVID-19 exists and all of that, it really reminds me on the HIV history as well, because we had the denialists 20 years ago. We still have them, and they caused millions of deaths worldwide, and the same happens again. So this is another example that I want to mention in order to sort of point out that there's something in history that we could have learned. And this is not, of course, not a criticism to you, not at all. Thank you.
Thanks so much for that. I'll just head over to some questions from the audience. There's a question for a couple of questions actually for Jessica. The first one is from Fiona Ullendal, if I'm pronouncing it right, and this is from World Vision. And the question is, you highlighted the funding of Act A. Would you also see a need for reforms of Act A, and what should be changed or adapted in your opinion? And just for the audience, you know, there are deliberations right now on making permanent structures such as the Act Accelerator. Jessica.
Yes, thank you very much. And also for that question, to go back a little bit to the discussion just now, I would say I agree with many of the points that were made, especially since today we are talking also about lessons learned, right? So many of our comments are also meant to not repeat mistakes that have been made, even though we can acknowledge that very significant steps were taken to tackle some of these problems. The problems were caused in the first place, for example, by countries buying millions more vaccines than they needed. So I think that right now we have enough vaccines and we want to share them. That's a good thing, but we should not applaud too hard, because we also created this situation in the first place. And what you see is that the system is setting up for countries for failure in that sense. And that actually brings me to also maybe a point of critique, for example, to the Act A, the Act Accelerator. It's set up as a procurement vehicle to get in money and donations. But now that we have all these vaccines and we have a significant capacity to act there, you see that there's a problem with getting the vaccines to certain countries. So that is one point of critique, and the other would also be a broad point that this system of donations and then handing them out is part of that donor-recipient relationship. So this is really thinking about how to make a structural change that does not give countries that make sure that countries that do not end up in this situation. And these are again some political choices that I think one thing that we need is for people to care about this and to feel a bit of outrage about this and to speak to their politicians or to their representatives, and to think about how we can structure this better, because in the end it's a justice issue and not a charity issue that we are talking about. Yeah, I hope that answers the question.
Yeah, thank you so much. It's the second time that you mention political choice. So that's interesting. I was wondering if Mr. Bergfelder is still around. There is a question for him. Probably not. All right. So the other question really was, I think, maybe one of the other representatives from the German government could answer this. The mRNA technology was successful because there has been a lot of investment into it already, much before COVID-19. So is this one of the policy choices that the G7 could make, which is to invest more in public funding and also impose conditionalities to ensure equitable access? Is that something the G7 will consider? That's one of the questions from World Vision again.
I can also talk only in a personal capacity. Yeah, I think it's more than justified to think about conditionalizing when you put public funds on the table, that you want to see certain results in the public interest. So I think it's a lesson learned for the future. I cannot say more on this than in my personal capacity, because it's not my ministry in charge of this issue. So it's the Ministry of Education and Research that, to my knowledge, has given funds to BioNTech in this in the starting phase of development of the new mRNA vaccines. But in general, it's an instrument, or it's a tool that's available to us, and in the framework of negotiations between government and company, this is definitely viable.
Thank you. There was a question on price discrimination of vaccines, how that could impede access. Does any of the panelists want to address this? Maybe Professor Kamradt-Scott or Mr. Wiessner?
Sorry, can you just repeat the question, because I've lost it further back up?
Yeah, the price discrimination on vaccines, how that might impede access. I think this was touched upon earlier in the discussion.
Yeah, I mean, I think other folks actually raised this issue. So a lot of this goes to obviously things like the advanced purchase agreements that we saw governments negotiate. And again, this comes to the question around transparency. And I accept the point that was just made about lessons learned for the future. But I think our challenge right now, obviously, is that globally we've seen the Ukraine crisis overtake many of these things, and I'm genuinely concerned that we're already falling back into the neglect phase of the cycle of panic and neglect. And in this context, though, you know, so long as we're able to sort of capture these lessons learned and make sure that we can try and get some sort of international consensus in the future around when governments do enter into advance purchase agreements, that there is some sort of mechanism by which we can ensure more transparency and thereby equity. You know, either that or that that governments would agree to some sort of mechanisms by which we would see you know, limitations being put in place with regards to advance purchase agreements. I mean, there's a variety of discussions that really are quite fundamental that we really need to have. Now, the G7 is, because of exactly who they are, you know, a lot of these discussions that will occur in the G7 will help set the agenda for the international community. And, you know, when we sort of see G7 members also being quite supportive of other initiatives like the pandemic treaty proposal, which has been floated, then, you know, these are going to be critical discussions that we've got to have, and we can't afford to sideline them or put them into the too hard basket. So price differentiation is a key issue that we're going to have to address, and it ties directly back into this conversation around equity and how we make the system more equitable and accessible to all. And, you know, again, like, so long as these lessons are learned and captured, and that we can sort of take it from there. But we still also, as others have pointed out, we've got a crisis which is ongoing still at the moment. Without harping on this point, you know, it's fine for us to say that the vaccine supply is no longer a problem, but we've got to make sure that we do, as an international community, including the G7, help those countries to get the vaccines in arms so that we don't see more variants emerge that could then set us back to day one in terms of the vaccines, the effectiveness of the vaccines that we've got right now. So we can't lose sight of this being an ongoing crisis, that we need to ensure that there is multilateral cooperation and action to resolve.
Thank you for that. I'll just go back to Jessica and Mr. Wiessner. Would you have some concluding remarks?
Yeah, maybe I can start. In terms of pricing, I think we act as if the market would rule everything. I don't know everybody who studied social science. You have this Adam Smith, the invisible hand that would rule everything. So you just let the market do what the market does every time, at any time. But in terms of life-saving medicines, we see that this is not happening. The market does not think in terms of human rights, access for poor, does not consider that at all. The market thinks in terms of profit making. And this whole rhetoric has to change. I think this needs to be addressed. And the G7 would be a space to address exactly that the world needs to change. We talk now about COVID-19. We did not talk about cancer drugs. There are millions of people in the global south that die on cancer because they simply cannot afford that. And these are drugs that are not incredibly expensive. They would not be incredibly expensive. They are incredibly expensive because the pharmaceutical industry is allowed and encouraged to exactly raise the price that wants to have. Nobody's going to control it. There's no transparency on that. This is proven many, many times, and this needs to be addressed, and this has to be changed. I think these are my final remarks on pricing. Thank you.
Thanks a lot. Jessica?
Yes, thank you. I agree very much with what has been said, and I think we have conclusions from this conversation on what to do short term, but also what to not repeat. And we have seen that many of the things that we need to do also short term come from governments to act and interfere and to make some important decisions to change this narrative. Thank you.
Thanks a lot. I will exploit my moderator's privilege, and I have a question for Professor Kamradt-Scott. You know, you're part of the, you know, informing the process around the G7 discussions, but how do you also see that in the context of ongoing discussions on the same issues at the G20 level? How do you think this will pan out?
Yeah, I think this is really important for both groups as much as possible to try and work out. But I also noticed, I note Katie's point earlier that, for the G7 at least, and particularly for the health ministers, this process is rapidly drawing to a conclusion, particularly with regards to what's going to be the key recommendations that are put forward to leaders. And so it's really quite important that the two groups do try and cooperate as much as possible, because obviously the same G7 members are in the G20. But we haven't seen that sort of close cooperation. I just as an observer, only being involved in this process for the first time this year, I would sort of suggest that there's more work that needs to be done to try and actually bring that cooperation between these different advisory groups together, so that there is more synergy wherever possible. Having said that, we also have to accept that there's different groups that are going to arrive at vastly different conclusions, and that's okay. We just need to then actually be able to work through those processes and try and gain a bit of a consensus. And I think so long as we can agree on sort of like core principles, such as avoiding further fragmentation of the global health system and architecture, then I think, the other issues that start to come up then become sort of around the margins as to what is the best way to achieve that, versus, different propositions entirely, seeing the creation of new agencies and new groups and so on. So I think, again, there's probably lessons learned that I would suggest needs to be taken away from this process. But I also understand that the whole sort of T7, T20 set of arrangements is also a fairly new development, and it's still obviously sort of embedding in. So I think, lessons learned there, and certainly something for the future. We're already looking towards the next G7 as well, and we're keeping in mind, again, I can't sort of give away too many of the recommendations here, but we're already sort of looking forward as to how we can ensure better coordination in the future between these different groups.
Thank you so much. Thanks to all our speakers on the panel and from the floor as well, and for your questions. I think this was a great conversation, and hopefully will feed into the wider process. The next event of the Global Health Hub Germany is in the first week of May, and we'll have Dr. Chikwe Ikwizu from the WHO Pandemic Center in Berlin, and Johanna Hanfield from RKI, and they will be talking about the role of data, surveillance, and intelligence in pandemic preparedness. We look forward to seeing you here again, and invitation and further information will soon be sent to you through the newsletter and on the website. Thanks so much for joining us this afternoon. Have a nice rest of the day. Thank you.